Fibromyalgia. Fibromyalgia is a common and chronic syndrome affecting your bones and muscles. Fibromyalgia causes widespread pain, fatigue, and other types of discomfort. It most commonly develops between the ages of 25 and 55 but can occur at any age. It's thought to be caused by your nervous system in your brain and spine not being able to control or process pain signals from other parts of your body. Most fibromyalgia cases are diagnosed in women, but men and children can also be affected. There is no cure, but a combination of medication, exercise, and lifestyle changes may ease your symptoms and improve your quality of life. Causes. The exact cause of the chronic widespread nature of fibromyalgia pain is unknown. Fibromyalgia is a problem with central pain processing in the brain where there may be an increased sensitivity or perception of pain to a given trigger. When you have fibromyalgia, your body overreacts to things that should not normally be painful. In fibromyalgia, you will feel pain from things that should not hurt at all. Sensations that were not painful before become very painful over time. Different people report different things that seem to trigger their condition. However, available research still doesn't pinpoint an exact cause for fibromyalgia. Symptoms. Fibromyalgia symptoms have generally been more severe in women than in men. Men also get fibromyalgia, but they may remain undiagnosed and it may affect their quality of life, relationships, and career. Symptoms resemble those of arthritis, but fibromyalgia affects the soft tissue, not the joints. Common symptoms include widespread musculoskeletal pain. Pain is the hallmark fibromyalgia symptom. The pain may feel like it's affecting your whole body, or it may be particularly bad in just a few areas. The pain can range from a mild achiness to an intense and almost unbearable discomfort. General fatigue, tiredness, tender or overly sensitive joints and muscles, difficulties with memory and concentration, insomnia, feeling nervous or depressed. Fibromyalgia can feel similar to osteoarthritis, bursitis, and tendinitis, but rather than hurting in a specific area, the pain and stiffness could be throughout your body. Other symptoms can include headaches, dry eyes, sensitivity to cold, heat, breathing problems, numbness or tingling in hands and feet, irritable bowel syndrome, restless leg syndrome, skin problems, depression, and anxiety. Symptoms can appear at any time during a person's life. Symptoms of fibromyalgia can be confused with those of arthritis or joint inflammation. However, unlike arthritis, it has not been found to cause joint or muscle inflammation and damage. Fibromyalgia trigger points. People who have fibromyalgia have a reduced threshold to pain. There are 18 tender points according to the American College of Rheumatology that are used to identify specific areas of the body that felt more sensitive to touch to fibromyalgia patients than to someone who doesn't have this disorder. These tender points help to differentiate between otherwise healthy people and people with fibromyalgia. In the past, people were diagnosed with fibromyalgia if they had widespread pain and tenderness in at least 11 out of the 18 specific trigger points around their body and cause pain for at least 3 months. Common trigger points include back of the head, back of the neck, back of the shoulders, lower neck in front, upper chest, arm near the elbow, hip bone, knees, upper outer buttock. These trigger points are no longer a part of the diagnostic process. Risk factors include a stressful traumatic injury, rheumatoid arthritis, autoimmune disorders, and genetic factors. Other factors include gender. The condition is much more common in women than men. Genes. Fibromyalgia may also be hereditary. If you have a family member with this condition, you are at higher risk for developing it. Stress has been linked to hormonal changes that could contribute to fibromyalgia. Trauma. People who go through a severe physical or emotional trauma may develop fibromyalgia. Medical conditions like rheumatoid arthritis, lupus, or spinal arthritis or an infection raises your chances of developing fibromyalgia. Child abuse. Children who are abused are more likely to have the condition when they grow up. Inactivity. The condition is much more common in people who are not physically active. Exercise is one of the best treatments for fibromyalgia. It can help relieve the pain. Diagnosis. Your healthcare provider will examine and may diagnose you with fibromyalgia if you have had widespread pain for 3 months or longer. No lab or diagnostic test exists that can accurately confirm a diagnosis. Instead, because the symptoms are so similar to other conditions, your doctor will want to rule out illnesses such as an underactive thyroid, different types of arthritis, and lupus. Some people may be diagnosed and treated for one of these other conditions. It's also possible to have one of these conditions as well as fibromyalgia, so you may get blood tests to check hormone levels and signs of inflammation as well as x-rays. Your healthcare provider may use these tests to help rule out other possible causes of your chronic pain. Previously, tender points were used to diagnose the condition. However, these are no longer recommended to aid the diagnosis of fibromyalgia. Treatment. There is no cure, but there are a number of ways your symptoms can be managed. Medications, exercise, acupuncture, behavioral therapy, and lifestyle changes can help relieve symptoms and improve sleep quality. Physical and psychological therapies can be a more effective way of managing fibromyalgia than medication. Treatment may include physiotherapy, that can reduce the stress that triggers fibromyalgia symptoms and depression. Physiotherapists will show you the relaxation techniques and best exercises to strengthen your muscles without hurting yourself. Depending on your symptoms, your doctor may prescribe over the counter pain relievers, antidepressants, muscle relaxers, and drugs that help you sleep. Patients should tell the doctor about any other medications they are taking to avoid side effects and interactions with other drugs. Medications can relieve pain and help you sleep better. The main drugs approved specifically for fibromyalgia are duloxetine hydrochloride, help relieve pain and other symptoms. Milnacipran, pregabalin, and gabapentin are used to treat nerve pain and have been shown to help some people with fibromyalgia. Other medications may also be prescribed depending on the patient's condition. However, patients often stop using these drugs because they are not effective in relieving pain or because of their adverse effects. Talk with your healthcare provider to create a safe treatment plan that works well in helping you manage your condition. Occupational therapy can help you manage your everyday activities without increasing your pain. Exercise. Even if you are in pain, keeping active is really important part of the treatment for fibromyalgia and can prevent other health problems. Your symptoms and general health can be improved by a combination of aerobic exercise and movements that improve your flexibility and strength. Exercise as often as you can, exercising a little bit each day in the beginning and then gradually building up from there is recommended. Stretching and strengthening exercises can help provide support to the muscles and other soft tissues of your back. Exercise and stress reduction techniques can help you feel better both mentally and physically. Many natural treatments like yoga, meditation, acupuncture focus on lowering stress and reducing pain. You can use them alone or together with medical treatments. Behavioral therapy can help you manage stressful situations. It includes learning new coping skills and relaxation exercises, which aims to reduce negative, stressful, or pain increasing experiences and improve positive, mindful behaviors. Diet. There's no particular diet that's been proven to help fibromyalgia. However, it's recommended that you keep to a healthy weight by eating a balanced diet, eat fresh fruits and vegetables, drink plenty of water, eat more nuts and seeds, eat food that is low in sugar and high in fiber, which helps boost energy. Avoid foods that have gluten, additives, and preservatives, which will help reduce pain. Maintaining a balanced diet and healthy weight is vital to ongoing health and can improve a person's quality of life. Fibromyalgia symptoms vary from person to person. There is no definitive cure for fibromyalgia. With this condition, your quality of life can be affected when you live with pain, fatigue, and other symptoms on a daily basis. It's difficult to predict how long you will have the condition and the impact it will have on your life. Some people consider fibromyalgia as a psychological problem, but in general, it's a very real physical condition. It's the result of widespread dysfunction in the body and the brain that's hard to understand and difficult to treat. Symptoms can improve significantly as long as the patient follows proper treatment plan. Thank you.